So, hello, I'm Sandra from Therapic. What I want to talk to you about today is the difference between a psychiatrist, a psychologist, a counsellor and a psychotherapist. Because I'm not even sure I knew before I started researching this. It's been very interesting. So I thought I'd explain the differences to you today in as simple a way as possible. So, a psychiatrist, they are a medically trained doctor. They have gone to medical school and trained as all doctors do for 4 years, and then they have gone on to specialise in psychiatry. Psychiatrists can prescribe medication. None of the other types of therapists can prescribe medication. Now, psychiatrists used to do a lot of therapy with people, but nowadays it's more medical checks that they will do with people. They work with issues at the severe end, so they will work with severe psychological and psychiatric issues. They may also specialise as well in areas such as the elderly or children or neuroscience, those kind of things, people with brain injuries. So they are essentially a medical doctor. Psychologists will also do a 4-year degree in psychology. Psychology is the study of the mind. So psychologists generally will test, diagnose mental health disorders, psychiatric issues. They have lots of questionnaires they can do with people and lots of scientific tests that they can do. They may then also go on to specialise after doing their original psychology degree. So there we have the differences between psychiatrists and psychologists. Psychiatrists are medical doctors who can prescribe. Psychologists study the mind and study disorders of the mind. Let's move on to counsellors and psychotherapists. I'm going to talk about counsellors first. Counsellors tend to deal with things that are very here and now. So people will come to a counsellor with a very specific issue, and counsellors will work in a short or medium term way to deal with that specific issue. They will give people strategies and self-help tools to go away with and practice and work with. We have people such as drugs counsellors, schools counsellors. They will work with that very specific issue in the here and now and perhaps even looking forwards. Then we have what we call psychotherapists. Psychotherapists tend to work medium to long term. They have very great skills at creating a relationship with people and getting quite deep and going into the past with clients. So we will look at childhood, they may look at unconscious things that are going on with people and explore those with a client in order to deal with what's going on here and now for somebody. The work is very in-depth, but psychotherapists are also able to be counsellors. They're also able to deal with recent issues, very here and now stuff that's going on. Now we come to psychologists and psychiatrists. We bring those back in. Psychiatrists and psychologists can also then train in psychotherapy and become psychotherapists, as well as their tags of psychologists and psychiatrists. So I hope I have explained that in as clear and simple a way as possible. I think within all of this, it's clear to see that counsellors are not psychotherapists, psychiatrists or psychologists, and psychotherapists are not psychiatrists or psychologists, but psychologists and psychologists and psychiatrists can be psychotherapists. Is that clear? I hope so. So what I want to do with Therapic is open things out, make it more transparent, start conversations. If you've had a negative experience, come and talk to me and we will try and deal with that. As well as if you've had amazing experience in therapy. What the ultimate aim of Therapic is to allow the amazing therapists in this world to absolutely shine, so that when you are looking for a therapist or you need to move area and need a new therapist, that therapic will show those amazing therapists that are out there. You will know that when you go on therapic, they have the best therapists on there. That's what therapic's all about. And we want to open up the conversation with clients. Tell us about your experiences, good or bad, in a safe environment. So look me up on Facebook, therapic.uk, and let's get the conversation started.